breathing is incredibly important, not just because obviously you're going to die if you don't breathe, but for the function of your brain, the function of your neck, the function of your back. So we're supposed to breathe from our diaphragm. That means that our bellies expand as we breathe. Very often what patients will do, and just about everybody does, when they breathe this way. The chest and the shoulders go up. That's an improper pattern. That's a fight or flight pattern of breathing. You're supposed to breathe from your belly, which is rest and digest. It actually switches your nervous system really immediately. What does that mean? That means that if you're anxious, if you're stressed, you are breathing from your chest and that's not enough air, so you're hyperventilating. As you hyperventilate, you over-oxygenate your blood, get rid of your CO2, and that causes a shift in your blood's pH level. Long story short, because of those changes, your brain and your muscles and your organs can't absorb oxygen, can't absorb nutrients. You're disrupting that process. So now your brain, it's like temporary insanity. If you've ever experienced an anxiety attack, you know what I'm talking about. It's a kind of temporary insanity. Why? Because your brain's not working correctly, because it's not getting oxygen. You feel like you're drowning even though you're not in water. So, how do you resolve this? If you're in that state, you grab a paper bag, not a plastic, but a paper bag, wrap it around your face and breathe the air in and out of that bag. It's going to take, maybe 10, 15, 20 breaths, and it's going to start feeling better. And maybe in an hour or two, you will start to feel better. That's in an emergency state. You could pass out from that. Be very careful. You're not driving. You're not in the water. Be safe when you're doing that kind of thing. Your brain is not working correctly, so you got to be careful with that. Okay. Here's a better solution. Learn how to breathe correctly. If you learn how to breathe correctly, you'll never have that anxiety attack. Even in rough situations, emotionally, you'll never get to that peak where you have an anxiety attack. So to learn how to breathe correctly, you have to use your diaphragm. Maybe there's a reason why you're not using your diaphragm. It can be because of the way you work out. It can be because of the way you're breathing while you're running. It can be because of stress causes that spasm in the diaphragm. It can be because you never crawled. If you never crawled as a baby, your core doesn't work properly. There are a number of reasons why you might not be breathing from your diaphragm. It's my job as a neurosomatic therapist to figure that out, work on your body, and then give you homework so that that doesn't happen again. So if you have anxiety, if you feel anxiety, nobody's going to take away your problems in your life. We all have issues, and some of us have much more serious issues than others. So that's a separate topic. What we can do as a neurosomatic therapist and a patient is we can work on your body so that you're more resilient. You can actually deal with that stress much, much better, deal with that anxiety much better because your brain is working correctly. So I can help by working on your body, teaching you how to sit properly, breathe properly, function properly with your core as well. And that is how we can work on issues of anxiety, like anxiety attacks.